Welcome to another episode of Health Your Way podcast, where we discuss health issues ranging from physical, mental, emotional, as well as current facts. Today, we're going to be talking with Dr. Angela Cortal. She's a naturopathic doctor based in Oregon and the best-selling author of Younger Joints Today. She's passionate about reversing joint disease by addressing the root cause. She loves partnering with her patients to optimize their health, happiness, strength, and well-being. And I would like to say thank you for being part of this podcast. I sincerely appreciate it. And yes, anything you want to add to our audience?
Well, thank you. Thank you for having me. And no, I think that was a wonderful introduction.
Oh, I appreciate that. And I think I've done some research on you, and I really thought, you're passionate. You're passionate. I looked you up, and I thought this would be a great conversation. I'm glad that you wanted to have this conversation as well. So today's topic, actually, we're going to be discovering how to turn back time, the hands of times when we're talking about our joints. And a lot of us, as we age, even, I may not be as old as most people, but I got joint pain. I feel it. I feel it in my knees. I feel it everywhere. I think before we understand how to turn back it, let's understand what happens to our bones and joints as we age. Can you give us some high level information that we can share with the audience?
Yeah, I'd love to. And I start this topic by also just introducing the idea that it's not so deterministic. It's not just that we just have to age and fall apart and and that things are just going like on a one-way path towards destruction. I mean, you and I both are like proactive people when it comes to our health, when it comes to people we work with, and we know if you intervene and change the course, big, wonderful, positive things can happen. So when it comes to degenerative joint disease, by and large, that's osteoarthritis. And I would say that it splits into two big camps. The area of things that you really don't have a lot of control over, that we just know are risk factors, so we should be aware of and do what we can to kind of support and optimize that. And then a whole other large slew of things that we can actually intervene and change. And so, yeah, you mentioned age, and the osteoarthritis does tend to come on as we accumulate decades. Those of us women are at increased risk. If someone's had a surgery, say to your shoulder, hip, knee, that specific area definitely has an increased risk for arthritis. Depending on what someone does with their body. So if they have a work that has a repetitive injury, I treat a lot of patients where they're doing overhead work, and that over the years and decades really wears out your shoulders. So yeah, there's a lot of things that we just don't have a whole lot to say about. Family history and genes come in, but then we turn the page and everything that we do have a say about. So what we do with our body in our free time, like, are you working on your physical health versus being a little bit more sedentary, inactive, no muscle development sort of thing? I mean, this is why I wrote my book, is to get the message out there. Like, don't just sit on your rear end and wait for someone to say there's nothing we can do for you but a joint replacement surgery. Like, let's get going, people. We got some time. Especially since a lot of my patients are told, like, oh, the ibuprofen or the physical therapy didn't work or didn't really work. Okay, well, wait 5 or 10 years and then we'll talk about surgery. It's like, don't just wait and do nothing. Like, this is the time that we can change the course. We can still make a really huge impact. So I mean,
sorry, so you can't just say
yes.
that and then not have me. I think for me, I'm sorry, it just took me a while. So you're telling me that there are some people that have told that, okay, you know what, it's not helping, so wait 10 years and then we can replace your hips. In that 10 years, what are you doing? You just waiting to just get your hips replaced?
I hope you can hear my audible sigh, because yes, I hear this a lot from patients, and that what it is they usually have on the imaging, the x-ray, the MRI shows a mild to moderate osteoarthritis. So to your point of kind of what changes, if we're talking about like what changes structurally, what changes on imaging, they can see the cartilage starting to decrease, thin. It's not all the way gone. It's not bone on bone, but we're starting to see those signs. The joints can have nodules, thickening of the capsule, bony growths happening, osteophytes is what they'll say on the imaging. So we're starting to see some of those things, but the severity according to the picture isn't quote unquote so bad, even though that might be just life-altering impact for someone. And they're like, I'm suffering, I need to do something. What do we do? And if that initial course, that's just kind of the standard treatment course. And for some people, the physical therapy works great. But what I see is when it doesn't, is because we can only address the strength of the muscles around an area, the range of motion, like that kind of biomechanical piece, if the only issue is biomechanical. Okay. And so that's the whole reason why I wrote my book, is I was like, that is obviously a big piece of joint health, but there's all these other topics like nutrition, and the dots are often not connected there between what we eat or don't and actually supporting our joint health. Hormones is a big topic. That's kind of my passion, is sort of marrying these two topics, that hormones have a lot to do with our joints and what we do with our body, muscles, joints included, can have a positive or negative impact on our hormone health. And there's so these are all kind of the 10,000 foot view on things that we definitely can do to actually address, slow down, stave off those degenerative processes, and in some cases even reverse that.
I like that. And while you're talking, I'm thinking of some of the clients I have, and some I see people, and I find that a lot of people don't address the fact that, your joints and your bones are relations to how you feed your body, what you do with your body, how you, like, I'm not saying go jump around the streets to do some CrossFits. I'm not saying that per se. I think, the simple thing of getting more mobility or flexibility, how that can put less stress on some of the joints, or help get that elasticity in respects to that. I think some people miss that. And then they don't understand that, if you have a issue or on one side of your hips, you're putting more strain on something, you're overcompensating, you're adding more pain to your joints that you can actually resolve now if you just address the root cause. And I liked when the introductions that you actually address the root cause of the joint issue, not the actual symptoms per se. Mm-hmm. I feel like I'm talking. Yeah.
Yes.
I'm sorry.
Yeah, you're definitely preaching to the choir there. I know.
Yeah. I'm just like, I'm thinking, and it's nice to hear someone say it as well, because you sit there and you talk to people and you're like, I'm in pain. I'm like, well, because you can't move. Like, how do you want to work out if you can't bend? I don't understand this conversation. Yeah. And it's really bad. And I think I'm sorry, I guess when you mentioned hit a big thing for me, I'm going to just bet this. It's just, I find that I see a lot of people that get physical, and if you can't bend or squat to a certain, or even kneel or something, having heavy weights or jumping around or even is not a good thing. And let's say you sit down all day. Fine. Let's just say you sit down all day. Because you sit all day doesn't mean all you do is making your muscles just stationary. They're getting stuck in that specific position. You're not giving them mobility. You're not, the lack of better choice, you're not oiling your muscles to make them. Yep. Okay, I'll move on.
And sometimes they turn into fat cells. The muscle cells will turn into fat cells if all they ever do is sit there and do nothing, because that's the signal you're giving your body. It all goes back to kind of communication. If you're not telling your body that you need it, and you need it to be strong, and you need it to actually perform for you, then it's like, well, why even be a muscle cell? I'm going to be a fat cell now.
I like that. And I think, I appreciate this conversation. Just to step back, I remember I mentioned earlier that you're a naturopathic doctor. I guess for the audience itself, I think, just to understand what that is and how that differs from a specific conventional doctor.
Sure. Yeah, I'd say there's definitely some overlaps and definitely some key differences. How our training is we build off of the same sort of 4-year medical education, taking all of the anatomy and physiology and immunology and pharmacology and all that sort of things. In Oregon and in the US and Canada, how the medical schools are set up is we're more or less trained for you can think of sort of like a primary care or family medicine sort of doctor, the quote unquote family doctor that you'd go to. And then each of us often will just sort of find our own passion and specific focus. So some out there focus more on digestive concerns or autoimmune diseases or support during cancer treatments, and where kind of my passion is that I mentioned is that overlap between hormones are important and your joint health and your muscle development and all of that sort of physically kind of marrying the endocrinology and the musculoskeletal or orthopedic fields. Because I see that if you only look at one and not the other, you're missing a huge piece of it. And so many of my patients find that sort of dual approach of kind of paying attention to the two areas of focus really valuable, because maybe they came to me for only something that they thought of as quote unquote just hormonal. I have a lot of hot flashes, fatigue, something like that, going through menopause. And then they mentioned, oh yeah, and all my joints hurt. And I'm like, well, that's also important. Don't wait until the 5th visit to bring this up.
Isn't that funny? They wait to tell you. I'm like, really? If you had told me at the beginning, we could have made some changes at the. Sorry,
I think it's sort of like our human condition that we only focus on the squeakiest wheel, you could say, and that we let other things kind of just be there in the background. And then conversely, other patients maybe come to me because their friend saw me, or they're referred by a chiropractor or a physical therapist specifically to be evaluated for the regenerative injection therapies that I offer. And during our course of kind of evaluating early on, it's like, and we really need to be looking into this, thyroid or blood sugar or something in the hormonal realm, where it's like going through this type of treatment, it really would just be in your best interest to get your hormones sorted out before you get this, a course of injection therapy, for example.
Okay, so just to bring it back, for a convention dog, you guys are roughly the same, but just the approach may differ. That's the main difference, what I understood from you.
Yeah, like the basic sciences and often our ability to order labs and prescriptions and those kind of things. That does vary state by state, but where I'm here in Oregon, like that's more or less similar. And so I'd say like that's sort of a core piece of dealing with patients, is that sort of internal medicine, and then we'll layer on where is our focus from the practitioner standpoint, so that we can really fully evaluate, like we're saying, root causes. And so I can kind of go on that path with patients to evaluate that, to investigate that, instead of just saying, I've never been and never will be someone where a patient comes to me for joint pain. I'm like, well, why don't just take ibuprofen and more ibuprofen and just keep doing that forever for the rest of your life?
So you're more of a holistic approach. I get it.
Yeah. It's like not just the Band-Aid. It's the kind of figuring out what's underneath there.
That's right. And I know that while you were giving us the description itself, you mentioned that you have a regenerative and medicine approach itself. What is that? And is it really backed by evidence-based science?
Yeah. So how I use it, I would say like regenerative medicine is a big umbrella where I put like the nutrition and the hormonal piece, because if I'm really regenerating something, that means we're addressing and reversing the degenerative processes. And so when we're talking about joint disease, then nutrition, exercise, hormonal health fits under that. But then also we have this piece that I had just mentioned of the regenerative injection therapies. So how I think of it in my mind is sort of a pyramid, where we're building up building up all these regenerative capacities, and then saying, okay, now is it time to then layer on an actual injection therapy, where that may be specifically addressing knee osteoarthritis, or a rotator cuff tendonitis, or tennis elbow, as people commonly call it, or recurring ankle sprain. So maybe it's something that we're seeing is pretty specific to one area. Okay. And I have someone's body and kind of all over, just kind of all over working well together, because we got the nutrition and the hormonal piece and everything else on board. And then the regenerative injection therapies, there's a number of specific ones, but Prolotherapy and platelet-rich plasma injection called PRP are the ones that I'm most typically using a lot of the time. Prolotherapy, where that's going into one specific site often, or a I'd say like a joint complex. So maybe it's like around the structures of a shoulder. You know, there's not just one thing going on. If you look at a picture of a shoulder, lots of tendons, lots of ligaments. And so depending on each case, we might be treating a few different sites to actually stimulate those spots to heal. That's the whole point of the regenerative injection therapies, is like they're providing communication to that area. In essence, telling the body, kind of tricking it, making it think it's a new, fresh injury. So it'll reinitiate the healing cascade, the healing process.
I like that. Now I get it. I
and kind of get that whole process restarted that may have just been sort of stalled out in this kind of chronic, lingering, quasi-injury, low-level inflammation that we often see.
I like that. I'm wondering, would it be fair to say that maybe a lot of high not high supporting, but high active, lack of choice, athletes may use that process as well?
Yes. Yep.
Okay.
Yes. I treat those. I see it working really well, because that's a patient population that I'm not having to cheerlead into, hey, maybe you want to be physically active. Usually it's the opposite. I'm having to put the brakes on, like, you need to like take a little bit of downtime and heal after this. Usually that's the opposite, but you know, they're really clued into their nutrition, often very aware of hormonal health. So we're really cruising through what, for some patients, it's taking us a long time to sort of investigate and sort out and put into place. And so, yeah, the more high level athletes, it is almost more like spot treatment, I guess you could say, where if something, I would say I'm often seeing a lot of those athletes with shoulder concerns, and it was just something that tweaked them. Maybe it was a dislocation they had 20 years ago, and then they just did a overhead press or bench or something that just, it was kind of the straw that broke the camel's back in the moment. And so we're doing the injection therapy just to get them back active, get them back, you know, doing it in the off time if they're in a sort of competitive cycle.
Okay, that's fair. Okay, I'm going to sidetrack for a second. So I know women that have a frozen shoulder. Would that be something that you've used for women that have frozen shoulders?
It definitely can. And I also see that that the hormonal piece is very important for those women.
Yes.
Yep. Yes.
And then
that always, like, it's like setting off like bells. What is going on with their hormones? And yes, what else can I do to support specifically the adhesive capsulitis?
Okay.
So I'm often I have a foot in both worlds generally, and definitely with those women, we're looking at the hormones and we're looking at the structures.
Okay, that's fair. I think a lot of people are listening to you and they're wondering, okay, is it safe and can it be used on any age group, or it has to be a specific age that it benefits from?
Sure. So in terms of the safety, there's going to be listed side effects out there comparable to any kind of injection potentials. It's always about, you know, minimizing risk for infection and making sure this is the right type of injection for each person, like matching that up really well, making sure there's no allergies. You know, using whatever imaging, so like ultrasound or fluoroscopy are the common ones there, to guide the injections being done in the moment as needed. And as far as age groups, I've just only treated adults. I know that especially in your more competitive youth athletic sphere, I have heard of other people using these in say like teen sports.
Okay.
Yeah. Like soccer, football, baseball are some. I don't have like a big youth sports practice or patient population, so I've personally only treated adults. But that being said, I've treated anywhere from, I think, right around 20, 21 years old to 90. and that there isn't any age cutoff that someone has to be, or they're too old and it won't work anymore. I really think it comes down to our vitality, our ability to respond to the injections, because as I mentioned, it's really communication. And then it's kind of like the injections pass the baton off to the body and they say, okay, here's an injury, now do what you're supposed to do and heal
I
it.
get it.
So if someone's just, their overall health, their overall vitality is compromised by chronic diseases, inflammatory conditions, just poor health, poor nutrition, inactivity, any of those will just diminish the capacity of the response, as well as a few medications out there. So kind of getting a sense of that full medical history is important for me to be able to then verbalize and be very honest and upfront with patients. Like, based on this, and this, you may not respond very well, or we may not want to be doing that injection at all, or we may want to set up this sort of plan to address a few things or get you off of a medication temporarily, so that we can optimize your treatment, so that you will respond for yourself as great as possible.
I actually really like your response, because it comes across, and it's good to hear it, that you're not just pushing on anybody. You're really understanding what, look, I mean, like, this is an option, but if you're not set up to actually benefit from it, it's not the right choice for you. Like, if you're eating burgers and you're like obese to a certain extent, and your body doesn't have the nutrition, or is not balanced enough to actually take full benefit of extra, lack of better choice, vitamins or minerals that are helping you kickstart your body, then it's just a waste of your time and money. And I appreciate you saying that. And I think if people are interested in, learning more about this process, learning more about your practice. Oh, before I go, do you offer practice online? Do you offer practice online?
Well, my practice, like everything else in the world, has changed radically these last few months. So telehealth has become a huge part of my practice, where it used to be zero, like basically none. And in these last few months, I've been doing a lot of initial visits, follow-up visits, pretty much any visits where I'm not doing an actual physical evaluation or injection treatment or something like that. I'm doing a lot of my work virtual. And as far as the rules and regulations go, so I can see patients in Oregon, because that's where that's kind of the extent of my medical license. I do have people who are outside of Oregon, other states, other countries, who at least want to discuss their case. And so I think of that as like a consultation. I'm not their doctor. I'm not providing them a diagnosis. But I can at least review things and say, have you looked into this? Have you looked into that? Yes. So I can do those remote consultations with those outside of Oregon, but it's a bit limited. It's definitely just a piece. It can sometimes get them further.
Yeah, it's not limited, because when it comes down to it, like, again, you're out there in the public, and you know a lot of stuff, and sometimes having that conversation with someone that understands, and it's like your champion, like, okay, Dr. Angela, I'll be like, Angela, this is what I'm having, this is the issue. If I want to go see my doctor, what should I discuss? What is the stuff that I should be looking? So that is really helpful, just having that conversation with someone that knows. I may not be there physically, but at least you can give me direction, give me a voice for myself. So that's why I said it's very helpful. Like I'd say that. With that said, how do people reach you out to you, and what's the best platform to reach you out on?
Sure. So probably my website is the clinic clearinghouse for everything. So for patients, for prospective patients, for people who just want to learn more about me, for consultations, it's drcortal.com. So it's DRCORTAL. And I certainly post things on social media, mostly Instagram and Facebook, and that's the same handle for both of those, which is Dr. Angela Cortal. And so, and I'm also sometimes providing online education and classes and other things like that. So I definitely almost always have something in the works there. But yeah, and then of course my book is sort of my big message out to the world that joints can heal. I mean, I could just put a period right there, because often it's just thought of as something that can't happen. And I want to say, no, it definitely can.
I like that.
So yeah, that's my book, Younger Joints Today, and it's on Amazon and can also be purchased directly through my website.
I think it's really great to hear because a lot of people, as you said, they accept that, okay, this is going to be forever. And there's a possibility, depending on your body, like, let's be real, depending on your body, you may not get 100%, but you can be better off for where you are. You can find a medium that's good for you based on your body structure, your background, your genetics and hormones. That's what you're basically saying when you say heal. Like, it doesn't mean you be 100%, but you can be a lot better than where you currently are. And some can 100% heal. Again, it all depends on where you are in your life and what your structure is. I feel like I'm talking too much. So with that said, Angela, and before we let you go, anything else you want to add, or anything else on why, somebody's reaching out to you, what sets you apart? Just, anything you want to add, my dear.
Sure. So I'd say I've kind of created my own little niche for myself of that. I think something hormone is going on, and I think something with my joints is going on, and that's where I love to help people out, is to just figure out that process, figure out, okay, what is going on, what can we test, what can we find out, so that we can get some answers, because that's sort of what I'd like to leave everyone with, is that there's almost always more to figure out. So if you feel like you haven't been given very many options, or quote unquote running out of treatments, or there's nothing more for you, and just sort of live with it, I want to say no. It just often can take kind of expanding your mind, doing some research, finding more approaches, finding more people to be part of your care team out there, because there's so much out there to be offered. And so I don't want anyone to feel kind of limited. I want to encourage them to just keep going.
I like that. So I want to say thank you for being a part of this platform. I've learned a lot. I felt like, you spoke for me, because it was like, sometimes you think of something, and then when someone says, you're like, see, my thought process is not crazy. It makes sense. It makes sense.
Yeah.
I do. Sorry. Once again, thank you for being on the platform, and, wishing you all the best. I think you're very passionate about what you do. You're very knowledgeable, and you have a lot to say. And if you don't live in Oregon, at this point, if you're struggling and you've gone through a lot of people, and you just having that talk with someone else, or even listening to her platform, that may give you that click in your head that, okay, you know what, this is something I'm missing. So thank you again. I appreciate this conversation.
Well, thank you so much for having me. This was wonderful.
Thank you for joining us today on our weekly episode of Health Your Way podcast. Don't forget to subscribe, share with others, and please feel free to comment below and ask any questions on topics we discussed, as well as future topics you'd like to hear about. Have a happy and healthy week, and be sure to tune in next week for the next episode on a Health Your Way podcast.